What is the normal homeostatic function of the SASP? So I guess what I'm trying to ask you is if you therapeutically target it in patients with cancer, do you expect to get some toxicity?
The normal homeostatic function of the SASP, if you just, aside of cancer, is maintain probably tissue homeostasis. Like, for example, there are like conditions in which, in good healing, or in others, in which you have a remodeling of the tissue, and some of the factors that are secreted by SASP are like basically leading that remodeling and also bringing the immune system to try to get the things right. A part of that, and you can argue if that's the role, that there has been like a couple of papers a couple of years back suggesting that senescence can also have a role during development, again, in shaping the tissue. So.
Can someone give another microphone?
Doesn't matter. So how does the SASP change based on nutrients deprivation or glutamine deprivation, given the role of mTOR as a nutrient relay? Do you know this? I mean, this would ultimately justify the dual effect of the SASP as detrimental and good, right?
Yeah, that's something that is very interesting, whether, so the question is whether metabolism or nutrients can affect the SASP. So it's something that, unfortunately, we don't have any data, but it's something that is very interesting because there is clearly also differential metabolic effects on senescence. So they have like different metabolism.
Very nice. I have two questions. One is you are focusing on cancer, but at the end, SASP could be very important in aging-related phenomena. And so I think that perhaps your blocking or activating should be read in that context, and I wanted to know what you are thinking. And the second question is more concrete. We have taken a completely different approach than yours. We are trying to kill senescent cells. So, and the idea of killing senescent cells is because at the end of the day, if you have a senescent cell around, it could be dangerous, it could re-enter cycle, and if you are thinking about aging, you want to get rid of aged cells, you want to replenish your body with young cells. So all your screenings can be retooled. And did you find anything that kills senescent cells instead of blocking or activating SAFs?
Yeah, no, both very interesting questions. Of course, that aging, there is like all the literature on inflammaging that is just causing or just disrupting the homeostasis of the tissues. So we are aware of that, and we are collaborating with, for example, Dominic Withers in that has like mouse models of aging in try to see whether some of these have some utility. And the other question was why not to kill senescent cells? Of course, that's something that, again, proof of concept has been done with the Van Dersen mice and Campisi mouse and others. And yeah, we are apart, so these screenings are like concentrated on the SASP, but a part of that, we are also, as a lot of people in the field, looking for compounds that kill senescent cells. So we have, at the moment, we are testing 3 compounds. So this is a screen of FDA-approved libraries. So we are testing those and re-screening some other libraries with a better suited assay. But I think that there can be scenarios, and maybe aging is more appropriate for reducing inflammation, but that might be scenarios in which killing or reducing inflammation might be interesting, so different ones. Yeah.
I also have a question, if I can ask you. So did you think about the possibility also to translate this to aging related to cancer? In other words, if you do chemotherapy or radiotherapy to a patient, it's going to have a lot of senescent cell on the body. So do you think that this senolytic approach that you are thinking about, so this modulation could work? For instance, a microdosage of rapamycin could be given to patient after chemotherapy just to decrease the SASP.
Yeah.
This could.
I'm lucky because he passed that. So he's asking you a question.
Okay. So in fact, the model that we used was slightly different, but together with our paper, the paper of Judith Campisi was also suggesting that rapamycin has an effect on the SASP. They tested, in fact, in prostate cancer, suggested to chemotherapy, and they suggest that over there, doses of rapamycin that not continuous but acute doses.
Later on, after the therapy.
Yeah, I mean,
But,
I guess that has to be tested. And
if I can comment, Andrea, the problem is that he showed you that rapamycin is also reducing senescence. So the risk of using rapamycin after radiation is that if you had the senescent response, which is beneficial, you overcome that, the cancer wishes you luck and goes off. And so I think that, by the way, this was confirmed by your own study. Rapamycin blocks peaks, not only OIS. So
that's a good question, Firpa. So did you check if this cell in which you, so ones that are fully senescent, you block the SASP, the cell, do they re-enter or not? In my opinion, they shouldn't re-enter. That's the...
Yeah, yeah, yeah.
If you did you try this? Because
We
we try
didn't-
actually
yeah.
with Paolo. But
We
never
didn't try
found it.
to remove rapamycin, but, well, I guess we can discuss it later.
We can
on,
discuss.
but- Yeah.